Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Coronary artery, and you're looking at the bypass grafting, then the CABG indications. So going by this, the class 1. The class 1 for CABG, and this is as per the American College of Cardiology, ACCC, as well as the American Heart Association, AHA. So this includes, there is a left main disease, there's a left main disease, then there is also a 3-vessel disease, there's a 3-vessel disease, and this can be with or without the proximal LAD disease. So it is with or without the proximal LAD disease. Next is the 2-vessel disease with proximal LAD disease, the 2-vessel disease, and this is with the proximal LAD disease, proximal LAD disease. And then comes the survivors of sudden cardiac death. So this is the survivors of the sudden cardiac death. So we're writing it as SCD, and this is with the presumed ischemia and the mediated VT. So presumed ischemia, mediated VT. Now let's look at the other indications for the CABG. So if you look at the CABG, the other indications, it includes the disabling angina. So there is disabling angina. Next is the ongoing ischemia in setting of non-ST segment elevation. So there is a ongoing ischemia, and this is in setting of a non-ST segment. This is in terms of the non-ST segment elevation MI, and this is unresponsive to the medical therapy. So it is unresponsive, and this is nothing but to the MT, that is a medical therapy. Next is in terms of the poor LV function. So there is poor LV function. So LV function but with viable non-functioning. So but with, there is viable, it is non-functioning myocardium, non-functioning myocardium. So this is about the anatomical defect that can be revascularized. So this is about the anatomical defect. So it is about the anatomical defect that can be revascularized. To learn and grow daily like this, please do subscribe.